Dr. Amy Nunn, what are you watching in Rhode Island public health right now?
Well, I've got laser-like focus on what's going on at the State House this week because the Senate is taking up the healthcare bills, and definitely a lot happening with that. And I'm excited that primary care and a lot of other public health issues are being discussed starting this evening.
I saw a study yesterday. These things are oftentimes kind of just clickbait nonsense. Wallet Hub says that Rhode Island is the second worst state for doctors to practice. But there is some data that would support that, some things we've talked about in the past. Just your take on they cite this very vague statistic, the medical environment in Rhode Island. As a practitioner and as an administrator, what do we need to improve the medical environment in Rhode Island right now in a nutshell without spending 8 hours on it, because I know we could.
Well, that certainly got a lot of headlines. And, I love Rhode Island, and we have a clinic here, and we're really proud of everything that we do. I think the challenges are really related to the climate for reimbursement, which definitely needs to be shored up. And I also, one thing that I'm really proud of is that so many people have health insurance in Rhode Island. We have, I think, the third highest rates of health insurance coverage in the nation. Following Massachusetts and Vermont. So it's certainly not all doom and gloom, but we've got to address our primary care shortage, and we have to do that by doing a lot of things. But I think one of the most important things that we need to do is improve our reimbursement rates. That will elevate that will help improve so many things in the health system. And I think until we do that, it is going to be a challenging environment to recruit physicians.
How do we do that? Is that a legislative process exclusively? I don't really understand even though I've been paying a lot of attention to it, I don't really understand how this is manufactured or where it comes from.
That's a great question. The short answer is it's pretty complex. It is a partnership between the federal government and the State House. So it requires federal action as well as local action. We need to increase the amount of money that we spend on Medicaid. And we need to increase the amount that we pay physicians and healthcare practices at the local level. And we also need federal action to better align our reimbursement rates with our neighbors in Massachusetts and Connecticut. Our physicians make about 30% lower. You can make 30 to 40% more by simply practicing medicine in Seekonk or just over the border in Dartmouth or in Connecticut.
Yeah, I mean, that's fundamental. And that's where sort of plugging holes is so important in a way. And we see that happening in a lot of different sectors, but also kind of opening up new ways of looking at solving problems. And that's something that you've been doing at the Rhode Island Public. You've been doing this writ large, actually, through your research in general, but through the Rhode Island Public Health Institute, of which you're the CEO, and through which you've launched and have had success with Open Door Health. So let's talk about Open Door Health. And it's positioned as the state's only LGBTQ plus focused clinic. And that's an important distinction. Why in this medical environment did you prioritize and identify very specifically? I mean, it's kind of an obvious question, but why did you come in to fill this role in this medical environment?
Thanks. We just turned 6 this week, last week rather. So it's our 6th birthday, and we're excited about everything that we've achieved. The short answer is there was an unmet need for an LGBTQ focused clinic. We were one of 13 states in the country that did not have an LGBTQ clinic. And so many of the patients that we were taking care of for infectious diseases at Brown Health, and which was then Lifespan, were telling us how much they needed a primary care provider. And we heard from hundreds and hundreds of patients that they needed a primary care home. And we decided we were up for the challenge, not really knowing how much work it would be to start a clinic from scratch. But here we are 6 years later with over 5,000, almost 6,000 patients, and so proud of the fact that we've been able to respond to community health needs.
You launched right before COVID, which is wild in a lot of ways, but you were right there, right before we started to pay a lot of attention to a gap in brick and mortar healthcare services on the whole, especially walkability for vulnerable populations. So in a way, you were ahead of the curve in the trend in terms of noticing a need for this, but you were also opening your operations during a time where, I mean, how much more chaotic of a medical environment could you get? So what was it like during your first year? What are your big takeaways from COVID that still apply today? Now, wow, 5-6 years later, 6 years later, wow.
Well, I think it's kind of like having children. It builds character. Definitely, it was a challenge. And I look back on it and it feels kind of like a sci-fi movie. You know, I remember coming into the clinic at the very beginning, because the clinic, we had to close 3 weeks after we opened, under, executive orders. And I remember coming in to the clinic because we were afraid that we might get looted, just because we weren't coming in. And so I would come and work remotely, and the highways were empty and everyone was at home. And, we opened and closed twice, alongside the executive orders, in response to the executive orders. We didn't have any patients at the beginning, so I was panicked that we might have financial problems. But thanks to the generosity of our donors and our community, we were able to stay open. And I feel just so proud of the fact that we were able to do that. And then, once the economy reopened, we reopened, and everything, was fine. It was certainly rocky because every time there was a COVID surge, we would have to pull staff out of normal clinical activities and have them run testing and then subsequently vaccines. But everything turned out okay. It wasn't a linear process, but we're still here, and I think the other crisis that we responded to in 2022 was the monkeypox crisis. Now the term used to describe it is called mpox. And I think, we are pretty good. One thing I've learned is we're pretty good at responding to emergencies because we're nimble and small, and we can hustle when we need to for our patients. And so, we've learned how to do that. And I think we've also had to do that in response to a lot of the challenges that have happened with public health during the Trump administration. And we've gotten to be pretty good at responding to emergencies.
Right. Well, it's an emergency right now in Rhode Island in healthcare. It's an emergency right now globally in terms of the picture that we're seeing. But you mentioned a word that I thought was so important, nimble. And that came from, that's a byproduct of COVID. Are you looking to advance in your career or explore a new field? The University of Rhode Island now offers a comprehensive portfolio of fully online programs designed to bring world-class education to you anytime, anywhere. Choose from a wide range of flexible asynchronous programs in business and leadership, data, tech, and STEM, healthcare and pharmacy, marine and environmental sciences, and much more. With expert faculty and innovative courses, you'll gain the skills and knowledge to thrive in today's competitive world. Ready to take the next step? Visit uri.edu/online and discover how URI Online can help you achieve your goals. URI Online. Learn anywhere with us.
You and your employees work hard for your customers. At HealthSource RI for Employers, we work hard for all of you. We offer access to 18 quality health insurance plans plus dental, flexible costs to meet your budget and get your staff what they need, and customized local support to guide you through it all. More than 1,200 Rhode Island employers choose health insurance through us. HealthSource RI. We work for you. HealthSourceRI.com/employers.
COVID existing and operating and frankly, in your case, providing essential services during COVID, nimble seems to be the opposite of what a lot of the healthcare system has become right now. So as people search for primary care providers, as that becomes maybe a top of mind issue for a lot of people, but just in general, what can healthcare administrators, policy shapers, anybody glean from Open Door Health as not only a model for the specific demographic that you've described, but just in general as a best practice for being nimble and being able to, as you say, hustle for your patients? I feel like there's a lot of people who they wouldn't even describe their relationship with their primary care physician as anything intimate, never mind someone who would be there to hustle for them.
Well, I think it's what this time in history requires. Public health is under assault. Medicine is facing a lot of crises. And, my background and training are in international health. And, we have been trained to respond to what people need. You can't just give them what you want to give them. You have to meet the moment. And so we take great pride in doing that and responding to what people need. The moment that we're not responding to community health needs is the moment that I should step down, because I think that's our goal, is to respond to what the community needs. I think it's really important.
How challenging is this environment right now in the Trump administration, where it's not only from a dollar standpoint, it's not only from an aspirational standpoint, perhaps, but it's also a psychological thing? I mean, let's be honest, there's an assault on knowledge, of which medicine is one of our core tenets that we've established as what has made us great as a species, and it's under assault. What does that do to a practitioner on a day-to-day basis as you navigate this environment?
Well, I think I feel like every day I have to be prepared for everything. So, and sometimes that means being prepared for things you hadn't even imagined. And so a lot of times my day doesn't look like I thought it would. My day at 8 a.m. or 6 a.m. looks one way, and I end up spending my day on totally different things. I think one thing we're making a concerted effort to do is to help inform the public about what they need to know that's important about their health and well-being. And being on this show is an example of that. There's a whole lot of misinformation and disinformation out there that needs to be corrected. And so we're trying to spend a lot of time working with the media to help people understand what they need to do to live their healthiest lives. And sometimes that means just getting on the news and saying, yes, you should still get vaccinated. Please vaccinate your children. No, you should not be eating beef tallow in lieu of olive oil. And disputing a lot of things that have absolutely no scientific grounding. There is a lot of misinformation coming out, and we want to be part of helping the public understand what they need to know to get access to healthcare and what they need to know to be healthy.
Yeah. I remember our podcast the day after it was announced that Tylenol was something that should be avoided for pregnant women to avoid creating an environment for autism and pushing back on that junk science at best. And
I had to spend a whole weekend reading all the science for that. And I feel like that's our job. That's what we want to be doing, is doing applied work that helps people understand how they can be healthy, not just, following the trend of just business as usual. This is an unusual time in history, and I think it requires an extraordinary response. And we want to help lead that response and put science back in the public health dialogue.
Yeah, no doubt it's important. I read a study that showed that there was a decrease in Tylenol usage among pregnant women after this announcement or proclamation from really Bobby Kennedy. And that shows the impact that this stuff has. So who knows how much further it could go if not for defenders of science, frankly. I mean, let's be honest. It's easy to try to be sort of objective about it, but the objective position is to say they're pushing back against science. What's next for Open Door Health? What's next for Rhode Island Public Health Institute? Anything on the schedule?
Yes, there's so many things that we're excited about. We're excited to expand our initiatives related to health and wellness, healthy eating, and active living. Those are big priorities for us. We have a new physician with us that is now offering what we call lifestyle medicine. And that basically refers to helping people live their healthiest lives by making changes in their dietary behaviors, the physical activity, and incorporating that into their health and wellness visits when they come to see us. So we want to expand that service, and that's being led by Dr. Sapna Chowdhury, who's our new medical director. And one of the other things I'm really excited about is just responding to the primary care crisis. There are 300,000 Rhode Islanders who do not have a primary care physician. And we hope that we can expand our services and help fill that gap. And we are working on a new building, which will be located across the street from the public safety complex in Providence. And we hope to be able to serve up to 20 to 25,000 people in our new facility. And we're in the process of designing that building and working with the city for zoning approvals.
Amazing. Dr. Amy Nunn, always a great opportunity to speak with you. And thanks for your work in this community.
Thank you so much for having me.
It's a rare thing that we follow up with the guest so quickly, but mere moments after we signed off, we had some major news we had to share. Dr. Nunn, the floor is yours.
So on April 11th, Open Door Health is going to be partnering with Dancing for a Cause and Studio One to have a fundraiser called Dancing with the Doctors. And we are working with 8 other physicians who will be having performances on April 11th at Twin River Casino. And both Dr. Chan and I will be dancing along with some of our board members and other colleagues and physicians across the state. And people can come out and see us and support. It's a fun event. It's kind of like Dancing with the Stars, if you've seen that. We're all taking dance lessons, and it's a contest. And we're just so excited to open up this event to the community so people can come celebrate our 6th birthday.
Well, there it is. Anywhere people can get information online?
You can email info@dancingwiththedoctors.com, or you can email Molly Kittler, molly.kittler@riphi.org. And we also have some information up on our website.
All right. Thanks again. No King's Day. The protest movement against President Trump returns to the country this Saturday, including on Aquinic Island. Newport Democrats Treasurer Rob Vitello says the moment has never been more urgent.
It's just amazing the steps that he and his administration are taking to undermine not only our democracy, but our standard of living.
You can find all the details for No King's Day across the country at nokings.org. Bill Bartholomew for Bartholomew Town on ripodcast.com.